This video is going to cover exercise 1 for Bio 160. You're going to need your lab manual and hopefully the internet or a textbook or some source. Wikipedia can work as well. All right, first I just wanted to mention a little bit about lab safety and rules. We'll talk more about this in class. But one important thing when we come to lab for the first time, don't wear any open shoes, no flip-flops, and also no food and drink are allowed in the lab. They should be put away before you come into lab. We'll try to leave no trace. The reason we need the toes and shoes covered and your feet covered is some people have cut themselves. We'll discuss the rules in more details once we meet together in our first lab. As you flip through the lab manual, you might notice that there's a lab assignment. This can only be done in class, so you'll actually want to skip that as we're working on the video at home, and we'll finish that and turn that in during our first lab meeting together. It's right there on page 8. If you want to remember, you can just fill your name in there and circle Monday lab if you're the Monday holiday lab. Alright, so we're going to start here in the first part. Exercise 1.3 is body cavities, organs, and organ systems. So there's no real good way to start anatomy without just jumping right in. So most of us are familiar with some of the major organs, so that's how we'll start. So if we look at our brain, our heart, and our kidneys, we can start to think about where are those located in our body anatomically. So those organs are typically located in cavities. So for example, we have our cranial cavity, our thoracic cavity, and our abdominal pelvic cavity, or sometimes we'll just call it our abdominal cavity. So you can probably guess where these different organs go. So that's how we're going to start here. We're on page 9. You can hopefully have your lab manual and you can make some notes to yourself so that when you study, you can remember these things. So for example, our thoracic cavity is really just our chest cavity. A lot of times what we'll want to write down in our lab manual are the more simple everyday words we use to describe these anatomical things. So our abdominal cavity, we use that term abdomen a lot, so you can imagine that's kind of in your stomach area. So where do we put our brain? Well, our brain's actually located inside the skull bones, and we call that area the cranial cavity. You also have your vertebral column, the bony spine, which has your spinal cord in the spinal cavity. So our brain sits up there in the cranial cavity. Your heart, you might guess, is in your chest cavity. Remember, we're going to call that fancy word for chest cavity thoracic cavity. If you can't pronounce these, there's always dictionary.com on the internet, and Wikipedia will have a little pronunciation for you. If you're wondering where your kidneys are and your bladder, those are in your abdominal pelvic cavity. Kidneys are actually stuck to the back wall there. Also in your abdominal cavity is your stomach and your intestines and other organs you may have heard of. For example, your liver is located in your abdominal cavity. Alright, so again, we're just jumping right in trying to learn some anatomy. Hopefully most of this is not new to you, maybe the names of the cavities. Another thing we're going to consider is that we often cover our organs or wrap them to protect them. And those wrappings and those protections have names, which we'll learn next. But we're going to sort of concentrate on these organs that we've already learned. So again, we've got our heart and our lungs and our thoracic cavity. They're going to be wrapped up and protected. We've got our stomach and our intestines and our abdominal cavity. Sometimes we call it our abdominal pelvic cavity. You've got your liver in there and your bladder. So the cavities are shown here. I wanted to mention that there's a structure called the diaphragm. You may have heard of the diaphragm because you use it. It's a skeletal muscle that you can control, and when it contracts, you actually breathe in. The reason I wanted to talk about it now when we're just learning about the cavities is the skeletal muscle diaphragm actually separates. It's the anatomical separation between your thoracic cavity and your abdominal cavity. All right, and it's hard to spell, right? Diaphragm, but it's spelled diaphragm. So make sure you remember that. All right, what about those protective covers, those wrappings? This is a little more advanced because you probably haven't heard of these before. Well, we've got this one thing called the Dura. One of the easiest things to do when you're not sure what we're talking about here, or when you're studying at home, is just Google Dura. And you can see, I like dictionary.com. And so, one, you can learn to pronounce these things, but you can also learn what they are. So it's this fibrous membrane or sheet around our brain and spinal cord, and it literally means tough or hard mother from Latin. All right, so the Dura mater, you can imagine, is a tough sheet that protects and covers your brain. Where, again, is this located? Well, you're inside those skull bones, which protect your brain and create the cranial cavity. Your brain sort of sits in there in some fluid we'll learn about called cerebrospinal fluid. But a sheet, a tough sheet, that's why it's called the Dura mater. This tough sheet of connective tissue surrounds, wraps, and protects your brain, and it's called the Dura mater. Again, why learn this now? Well, I just wanted to get you in the mindset of how anatomy is based on Latin, and how we can sort of learn each of the organs has its own wrapping. All right. Again, if you wanted to see the Dura mater, just type in Dura mater in there in Google and find a picture. Here's one from Netter's Anatomy showing that Dura mater cut so that you could actually see the brain. You won't be able to see the brain unless you cut open that protective cover. If you don't like graphic stuff or surgery scenes, you can just kind of squint your eyes or fast forward. But here's a picture from a surgery where they're going to do surgery on a tumor inside the brain. So they have to cut that Dura mater, which is that white sheet there. They fold it back, and then you can see the surface of the brain. There's some other protective layers that protect the brain, which we'll learn about later in the course. All right, this would be a good time maybe just to pause and get your internet access or your textbook out and your lab manual and just try to look up each of the three remaining covers, the pleura, the pericardium, and the peritoneum. The pleura protects our lungs. It's located inside your chest wall and around the surface of the lungs. The pericardium surrounds the heart, and the peritoneum covers the abdominal wall and the abdominal organs. All right, so again, don't get too stressed about this. We're just learning it for the first time, but we've learned our organs. We know what cavities they're in, and now we can name the protective covers, hopefully. A lot of students have trouble remembering all of them because a lot of them begin with P, but just practice, maybe make a flashcard or a list, and you can do it. The next thing we're going to want to do is label that diagram on page 10 in your lab manual. And again, think about the cavities. That's pretty easy, right? G is sort of that whole thoracic cavity. H is showing you the abdominal cavity, or if you want to call it the abdominal pelvic cavity. We can see our diaphragm sandwiched in between there, which divides those. Hopefully you recognize some of the major organs, the lungs, the liver, the stomach, the intestines. So let's focus on those protective covers. Remember, A and B, which are protecting our lungs, that must be the pleura. E and F, which are wrapping the heart, is the pericardium. And then, of course, the peritoneum, which wraps the intestines and the abdominal organs. If you ever want to know where these words come from, why did they use the term pleura, you can always Google it and look up the etymology, or where do these words come from. In this case, it means the side of the body related to the ribs for the pleura. So one of the things you might notice is that the lungs are surrounded by A and B. It almost looks like the pleura must have two layers, and that's true. And if you look at the pericardium as well, the pericardium has two layers. The heart is surrounded by a double layer. So one of the things we have to keep in mind is that these protective layers, not all of them, but some of them, the pleura, the pericardium, and the peritoneum, have a double layer. So we've come up with adjectives to help us with those double layers, visceral and parietal. So in this case, if we consider the visceral pleura, the visceral part is usually part of the organ itself. And the parietal part is usually detached, not directly attached to the organ. So in this case, if we look at the lungs, the layer that's not directly attached to the organ is the parietal pleura, and the layer of the pleura that actually is part of the lung is the visceral pleura. So again, if we look at the heart, we've got the protective pericardium, which is part of the heart wall, and then the protective pericardium, which is surrounding the heart. So how do we differentiate those two layers of pericardium? Well, we call one the visceral pericardium. That adjective visceral means that's the pericardium, that's part of the heart wall itself. And parietal pericardium will actually be loosely or indirectly attached to the heart. All right, and then when we consider the peritoneum, we can see that there's a wrapping around the abdomen. That's peritoneum. And we would call that the parietal peritoneum. Also, you would have the visceral peritoneum, which would actually be part of the organs there. I seem to have edited that out. Okay, we're back. So you see the parietal peritoneum, which is around the abdominal wall, and the visceral peritoneum, which is actually part of those abdominal organs. All right, so if you want to think of the parietal layer, sometimes it's like wallpaper. That's pretty advanced. So if that confuses you, just stick to pleura, pericardium, and peritoneum. All right, so we have our organs, we put them in a cavity, we got to protect them. Here's your actual heart's pericardium. If you cut it open, you could see the double layer, right? The layer that's part of the heart wall is the visceral layer, and then the parietal layer around it. If you look at a pair of lungs, you're actually looking at the visceral pleura, and you might be wondering, where is that parietal pleura? Well, it's actually left stuck to the chest wall. So wherever that chest wall of that animal went, that's where the parietal pleura is. You can think of the parietal pleura kind of like a wallpaper stuck to the chest, and the visceral pleura is stuck to the lungs. All right, again, the main thing we want to focus on: name the cavities, name the major organs, getting more advanced, naming the covers. For example, the cover of the liver would be the peritoneum. Something I'd like you guys to do real quick, we're going to talk about this in lecture a little bit, but make yourself familiar with the major organ systems. They're listed here in your lab manual, and what you can do is for each organ system, list a couple organs that are involved in that organ system. So for the urinary system, you've got kidneys and a bladder. That obviously filters our blood and makes pee. And so if you can do that for each of the organ systems, don't spend more than 5 or 10 minutes total. All right, and there's some questions you can answer. For example, if a cardiothoracic surgeon is going to cut open the chest and get access to the heart, he or she is going to have to cut the pericardium to actually get to the heart, the pericardial sac. And I wanted to show you that from an actual surgery. This is just on YouTube. It's kind of gross, but interesting. So you can actually see them. They're trying to open up the pericardium so they can see the heart. So remember, that sac that surrounds the heart is called the pericardium. Because it's not part of the heart wall itself, it's actually called the parietal pericardium. And you can see the heart beating in there. This is sped up, so the heart's beating a little faster than it really was, and they're moving really quickly to open that pericardium. All right, so that white layer that's got some blood on it, that's the pericardium. In this case, the parietal pericardium. All right, next, we're moving on. Exercise 1.4, Anatomy, Language, and Terms. This is a fairly large chunk of your lab manual, but we'll start with the language of anatomy. What does that mean? Well, a lot of the language of anatomy is Latin and Greek. All right, so that's kind of sad if you don't want to learn a new language, but you're going to kind of have to from time to time in our class, because anatomy terms are based on Greek and Latin. I wanted you to go ahead and look up some of these prefixes, roots, and suffixes that we'll commonly see in our class. And I just wanted you to see that medical terms aren't that confusing if you can just try to remember some of the common prefixes and parts of words. All right, so again, pause this, try to go down the list, do it on your own, see how efficient you can Google or look them up in your textbook. double check your definitions and see if they're close to what I came up with. Whenever I come up with definitions for these things, I always try to use only 1 or 2 words. Sometimes you have to write a whole sentence, but don't just copy what you see online because that'll get confusing. Maybe if you can just remember 1 word. For example, cardio refers to the heart. Itis refers to infections and inflammation. The suffix site, we're going to see that a lot, especially next lab, means cell. So osteo means bone and site means cell, so an osteocyte is a bone cell. And you can put a lot of these together and create fancy words. Hypocalcemia, hypo means low, emia means blood, and calc refers to calcium. So that's low blood calcium, or low calcium in the blood. Keep your definitions simple, and I think you'll have an easier time trying to remember them. If you didn't even know what pleuritis was, but you remember that pleura and itis is inflammation of the pleura, or inflammation of the lining of the lungs, or the cover of the lungs. All right, the next thing we're going to do is talk about how anatomists, radiologists, X-ray technicians chop the body up or cut the body up into these basic sections. There are 3 basic sections, and I want you to try to match each one up with the correct term. So again, something when we would cut the body, we could do it with tools, but usually we're going to do it with imaging. So in this case, a CT scan or an MRI. If you notice, we're cutting the body up, and this one's called a sagittal cut. We're chopping the body down the middle and creating halves, left and right halves. So if you imagine you had a head, that's the MRI we were looking at, and if you're chopping the body with these imaging techniques to create a right and a left side, you're going to have a view so that you can see sort of the inside of the body from the left or the right, just like this. So that was called sagittal cut. This one is called a frontal cut. You can see a tumor in there in the person's brain, but we're chopping through the body. That creates a front half and a back half so that you can actually see the brain, and as you move in and out, you can even see the eyeballs and the nasal cavity. So what are these cuts? Well, the cut that cuts through the body that creates a right and left side is called a sagittal cut. If you cut right down the middle, it's called a mid-sagittal cut. Again, this is a CT scan, and if you cut through the body from side to side, you'll notice that you're kind of getting this view from the right or the left side. Again, this is called a sagittal cut. A frontal cut's a little different. Sometimes it's called a coronal cut. You're basically cutting the body into a front portion and a back portion. So that one's pretty easy to remember, right? A frontal cut divides the body into front and back. When it's called coronal, it's really just talking or commonly used to refer to the head, but I notice on these medical websites that coronal is used more than frontal. So you can use either coronal or frontal, either one, they mean the same thing. Again, you're cutting the body into a front view and a back view. So here you can see the abdominal cavity through a frontal cut. Again, we said sagittal and mid-sagittal is simply cutting the body into right and left, and that only leaves one left, transverse. Sometimes I notice it called axial. Basically, you're chopping the body horizontally, and you're creating horizontal sections which leave you with a top and a bottom portion. All right. Again, you can cut through the body anywhere with any of these cuts. In this case, if you were to cut through the body going from the chest down towards the pelvis, you get these different views. These are transverse or horizontal cuts. Again, if you cut through the thoracic cavity, that's a transverse cut. You can see the lungs in there and the heart. The lungs kind of look like just big empty space, but we'll see they're actually not. And then if you were to cut through the pelvis, you can actually see things like the pelvic bones there, the white bright thing, and then that bladder sandwiched in the middle. So again, these are just 3 basic cuts. There's other types of cuts, but for our class, we're going to focus on transverse, sagittal, and coronal cut. Frontal cut or coronal. You can use those interchangeably. And we'll use transverse. Right, so make sure you can identify these different cuts depending on you're looking at the x-ray or the image or the cut open organ. You can name the type of cut. All right, next we're going to do anatomical directional terms. You might wonder, why do we need anatomical directional terms? Well, we're going to want to be able to say where on the body we're talking about, especially if we're writing a chart or reading about, for example, an autopsy. We're going to want to know where we are on the body. So these anatomical directional terms are used by all anatomists and sort of medical specialists. Anterior means front, posterior means back. Whenever we try to learn these, again, we try to keep simple definitions. Don't just copy what's on the internet. Try to make sense in everyday language. So anterior means the front, posterior means to the back. It doesn't really work for animals, so animals have a slightly different way to say towards the back is dorsal and towards the front or undersurface is ventral. All right, for the rest of these terms, try to look them up and come up with a one-word or two-word definition that helps you. All right, something to remember is that we have this imaginary midline of the body. It's almost if you cut yourself right down the middle, and we call that imaginary midline medial. As we move away from the medial part of our body, or the imaginary midline, we're moving to the side, and so we say lateral. All right, so if we're moving towards the middle or midline of the body, we say medial, and if we're moving towards the side, we say lateral. Superior and inferior are pretty easy to remember. Just remember above and below. Superior means above, inferior means below. We said medial is moving towards the imaginary midline of the body, lateral is moving to the side. Superficial and deep, we kind of use those in everyday language. Proximal and distal, I like to remember near and far. Near and far. Well, what are we talking about? Near to what and far from what? Well, we're usually going to be talking about the attachment point of something to the body. So if you're at the attachment point, you're proximal, and as you move farther away, you're moving distal. So for example, if we look at our shoulder, that's the attachment part of our upper limb. So that's got to be close or proximal. And as we move farther away from that attachment point, we get distal. So again, as we move to our elbow, we're moving distally. If we move back towards our shoulder, we're moving proximally. This becomes useful. If you had a mole and somebody says, well, that mole is just proximal, maybe 1 inch proximal to the elbow. If you remember, you go to the elbow and then proximal means back towards the attachment point, you know in which direction that mole is located. All right, so again, students probably have the hardest time with proximal and distal, but we'll keep practicing until we understand it. Again, if you had a tattoo that was distal to the elbow, for example, 2 centimeters, you would know to go towards the wrist side, farther from the shoulder. All right, so remember, wherever we're attached to our body, that's proximal, and as we move away, we're moving farther away, that's distal. There's tons of great resources on the internet. I just Googled proximal versus distal and it came up with all these other descriptions, superficial versus deep. But again, so here, proximal versus distal. As we move away from our body, we're moving distally. As we move towards our body, we're moving proximally. I wanted to mention that anatomical position, you're usually standing or flat with your palms forward and your thumb out to the side. So in anatomical terms, the thumb is lateral and the palm is anterior. All right, lateral to the side, anterior to the front. There's some fill in the blanks, so hopefully these make sense to you. For example, your eyebrows are above your eyes. If they're above, we use the term superior. The thumbs are to the side, so again, if they're to the side of our little finger in anatomical position, we should say lateral. The skin is superficial to most of our muscles, right? The skin is on the top. Don't forget the midline of your body is medial. So if you think about your nose is right between your eyes at that midline, so we would say the nose is medial to the eye. If you consider your pelvis is below or inferior to your ribs. The ankle, if you think about your ankle, remember the ankle is farther down your limb, so we should say distal. The ankle is distal relative to the knee. The hip, now the hip's close. The hip's close. It's actually at the point of attachment, so it's near the body. So the hip is actually proximal compared to the knee. The hip is proximal to the knee. Just remember, it's closer to the body, whereas the knee is farther. Or think of yourself hiking down and walking down your limb. As you move farther away, you're moving distally. So the hip is proximal to the knee. The elbow, if you think about the elbow is farther from the body than the shoulder, so the elbow is actually distal. Remember, the elbow is farther away. The wrist is even farther, so the wrist is actually even more distal. But we were talking about the shoulder there. So the elbow relative to the shoulder, the elbow is going to be distal. The shoulder relative to the elbow or the wrist is proximal. Again, just imagine you have to walk and actually march down a trail. As you move farther away from your point of attachment, you're moving distally or distal. Most of our bones are deep to things like muscles, so the femur is in our thigh and our quadriceps are in our thigh. If you didn't know, your vertebral column is to the back, so we say to the back is posterior. So the vertebral column is posterior to the sternum, which is your breastbone in front. How would this be useful? So say your patient has a scar, and that scar is on the medial abdomen, inferior to the belly button. So what does medial mean again? So think of where your abdomen is. Medial means down that towards that imaginary midline. It doesn't have to be right on it, but it has to be towards it. Versus lateral would be more towards the side. So medial towards the midline, lateral towards the side, and then inferior to your belly button. That's pretty easy, below the belly button. What about if your patient has a broken bone proximal to the elbow? So if you can find the elbow, if we move proximal, we've got to come back towards the shoulder. And so they probably have a break near their elbow, but just slightly shifted up towards the shoulder. If the break was distal to the elbow, then you move farther, move towards the wrist. Sometimes they'll actually give you distances, 1 inch or 10 centimeters. What about if someone says on your lateral thigh? Well, that's going to be towards the side versus the medial thigh will be towards the midline. Doesn't really mean middle. Medial means towards the midline. Again, superior, inferior. Superior tends to mean above, inferior below. All right, the final thing we're going to do is the final topic we're going to cover are these anatomical regional terms. So hopefully you feel like you're in the home stretch here. So these anatomical regional terms, what are they? They're basically adjectives to describe an area. And so, for example, you can't just tell somebody, that the arm thing or the leg or your stomach. You've got a scar or surgery on your stomach. What do we really mean? So we're going to learn very specific anatomical regions that define parts of our body. So for each of these, they're basically an anatomical region. You could say for each of these and add the term area or region. But I want you to try to look them up and textbooks, just Google anatomical regions and try to write a 1 or 2 word definition that gives you an idea in your mind where we're talking about. So for example, if someone said, where's the pectoral region of your body? I would immediately think the front of my chest. If somebody said the brachial region of my body, because I've taken anatomy, I know that means the arm. Or umbilical means the belly button area. Sternal, that's sort of that middle breastbone, so it's the middle front of my chest. A lot of these you've heard of, some of them you haven't. So the ones you haven't, make sure you look them up and try to write something that you can remember. Like femoral is the thigh area. Carpal is the wrist. I don't know if we're going to go through all of them in this video, but we're going to go through most of them. So, for example, famous area. The neck region is called the cervical region, or cervical area, or cervical spine. You may have heard of that, right? Somebody injures their cervical spine. That's very dangerous because it can disrupt their entire spinal cord. There's also the thoracic region and the lumbar region that's used often with the spine, but not exclusively. Thoracic region is the spine more up in the chest area, whereas the lumbar area is your lower back. Gluteal region refers to the butt, or the buttocks, people will say. The sacral region, you kind of look for those back dimples, and it's this triangular region between the gluteal region, but inferior to the lumbar region. We've got femoral for thigh, brachial for arm. This will come in handy later when we learn other things. For example, the brachial artery, right? We find it right there in the brachial region. The brachial artery is actually where you take blood pressure. And if you know the brachial artery, then you can name the brachial vein. That's why we learn these anatomical regions. It helps us name things like, for example, the muscles in the brachial region are called things like biceps brachii and triceps brachii to tell us that they're in that region of the upper limb. You've probably heard of carpal before, like carpal tunnel syndrome. That's in the wrist and the hand. If you're wondering how you can get all the answers for this without listening to the video and me, just Google image anatomical regions, and usually they'll have more listed because we're only learning a portion of the anatomical regions, but you can find your favorite picture. I like this one because it's in color. Remember to ignore the ones that aren't in your lab manual. Don't learn them all. You'll go crazy. It's hard enough learning the ones we're listing in our lab manual. So a new one we haven't talked about yet, popliteal refers to behind the knee. So for example, there's a popliteal artery and a popliteus muscle. Again, we keep saying brachial. Brachial is a pretty famous one. There's an area called antecubital. That's kind of a hard one. Antecubital area is really interesting because those veins in there, the antecubital veins, are where you actually give venous blood. When people take blood samples, it's usually from those antecubital veins. They're right there. I like to think of it as your elbow crease. Some students have called it their elbow pit. That works. But it's that front area at the elbow. The abdominal region is huge, and there's actually small regions within it. For example, the pelvic region, the epigastric region, the umbilical region on your belly button. If you have trouble finding the inguinal area is where your pelvic region or area meets your thigh. And a lot of people just call it their groin. But in our class as anatomists, we'll call it the inguinal area. All right, any of these that are confusing or having trouble with, we can go over in class when we first meet. The final thing I wanted you to do was maybe read this autopsy. This is actually Michael Jackson's death report or autopsy. And if you look at it, you'll see a lot of the terms that we learned being used to help you navigate around his body in this written autopsy. So, for example, they say he has scars on his medial left knee. So again, if you wanted to find his medial left knee, you would look to his left knee and then go towards that imaginary midline of the body. All right, again, remember medial means towards that imaginary midline, whereas lateral means to the side. He also had scars on his medial ankle. I'm not sure if he had surgery on these, arthroscopic surgery, because of dance injuries and things like that. Some more words that you might understand. He had degenerative osteoarthritis in his lower lumbar spine. Again, osteoarthritis in his lower lumbar spine. What does that mean? Well, lumbar, we learned, was that area of your lower back. Spine refers to those little bones in your vertebral column. Osteoarthritis, we know what that means. Bone, joint, inflammation. A final thing they mentioned that we're going to talk about is they mentioned that he had osteoarthritis and degeneration in his distal interphalangeal joints of his index finger, on his right index finger. So what does interphalangeal mean? Well, it basically means those joints between your phalanges or your fingers. And there's a proximal joint, a middle joint, and a distal joint. If you look at your own hand and your own fingers, you can see that. All right, that is the end. I wanted to remind you guys that when we come to class, hopefully you survived, when you come to class, we're going to actually take a quiz at the start of class. We'll have some time to review and talk first, but to give you an idea what's on that quiz, if you go to Canvas and you scroll down that module or the modules, go past all the lecture stuff. So there's lecture 12, lecture 20, lecture 28. When you get past all of those, you'll see lab exercise 1. It's where you found this video. Sample lab quiz 1. Go ahead and look through there and you can see actual images and questions from previous lab quizzes. There'll be about 20 or 30 questions.